am Anna Davis, and I work as the Hospital Staffing and Acute Care Regulatory Manager in OHA's Hospital Staffing Program. OHA's Hospital Staffing Complaint System is how Oregon's hospital staffing laws, including the updates in 2023's HB 2697, are enforced in Oregon. For investigations starting after June 1, 2025, OHA provides tools for the hospital to complete, which will help to clarify the information gathered, reduce the need for OHA follow-up questions, and provide more opportunities for hospital staff members to participate in the investigation process. These tools are provided on the first day of an investigation with the investigation needs list. In this video, we will discuss the RN staffing tool, including when the tool is used, who completes the tool, and how to complete the tool. The RN staffing tool is used in nurse staffing investigations involving RN staffing levels. It includes 3 sections: charge RN staffing, number of RNs on the unit and break coverage, and RN assignments. OHA will start a separate RN staffing tool for each shift and unit under investigation. So if there are multiple units or multiple dates under investigation, there will be multiple staffing tools included in the initial needs list packet. As you'll see on the next slide, OHA will complete the top section that lists the hospital name, the unit name, the dates under investigation, and the shift and time under investigation. The rest of the tool will be completed and signed by the unit's direct care representative on the nurse staffing committee and the unit manager or their designees if either individual is unavailable. The designee must be familiar with the unit's operations and has a similar role to the individual they are acting on behalf of. For example, if the unit's direct care representative is unable to complete the form, the designee who completes it must be another direct care RN who is familiar with the unit's operations, such as a charge RN. This slide shows the section of the tool completed by the OHA hospital staffing team, as marked by the 4 red arrows. These sections are in a box at the top of the form with a note in italics indicating that this section is to be completed by OHA. The beginning of the tool also includes instructions on how to complete the form. On this slide, the instructions are marked by a gold star. The instructions indicate that the direct care unit representative and unit nurse manager or their designees must initial and date the bottom of each page of the tool. This slide shows section 1 of the RN staffing tool, which asks about charge RN staffing. The direct care unit representative and unit nurse manager indicate how many charge RNs work during the shift under investigation. In the table, they provide the name of charge RN, time charge RN shift started, time charge RN shift ended, if charge RN covered breaks, and list the RN names for the breaks that were covered and the number of patient assignments covered. If not applicable, write NA. If the charge RN took a patient assignment not related to meal and rest breaks, list identifiers of patients assigned to that charge RN, and if not applicable, write NA. Section 2 of the RN staffing tool asks about the number of RNs on the unit and how the unit provided meal and rest breaks, as seen in question 5. In question 5, the direct care unit representative and unit nurse manager should describe how breaks were covered during the shift, such as by a break RN, charge RN, or by another process. Section 3 is the last section of the RN staffing tool and must be completed for each RN who worked on the unit during the shift or time under investigation. Provide the RN's name, shift start and end times, lunch start and end times, and, if applicable, the names of any RNs whose breaks were covered by this RN. Otherwise, write not applicable or NA. The table asks for information about each patient assigned to that RN. The first box asks for an identifier of the patient assigned to the RN, such as a medical record number, patient initials, patient room number, or other identifier. The second box asks for the staffing level required for the patient and why the staffing level was required. For example, if a unit cares for both med-surg and PCU level of care patients, then those levels of care would require different ratios, and you would write the required ratio followed by med-surg patient. This page concludes the RN staffing tool. It is asking the individuals completing it to indicate the additional pages that are attached to the packet by noting the number of attached pages, and has staff who fill out the tool confirm that they have initialed and dated each page, including this one, and additional pages. At the bottom is the attestation section, marked on this slide with a gold star. This is a space for the direct care representative and nurse manager, or their designees, to provide information about themselves. The two individuals who complete this form print their first and last name and their job titles in the corresponding spaces. They also sign the form and write the date signed, with the date including month, date, and year. The spaces to initial and date the tool will be in the same spot in the footer for each page of the form. The RN staffing tool is posted on the OHA hospital staffing website at www.healthoregon.org/hospital staffing. The OHA hospital staffing website also includes information about hospital staffing requirements and resources, such as FAQs, webinars, and hospital staffing shorts.